What is myasthenia gravis, or MG? Myasthenia gravis, meaning grave muscle weakness, is a chronic autoimmune neuromuscular disease. In simple terms, it's a condition where your own immune system mistakenly attacks the communication system between your nerves and muscles. This attack leads to fluctuating muscle weakness and fatigue that worsens with physical activity and improves with rest. It's often called a snowflake disease because its symptoms and severity can vary dramatically from person to person. The underlying problem, a communication breakdown. To understand myasthenia gravis, think of a nerve trying to send a command to a muscle, like contract. Normal communication. A nerve ending releases a chemical messenger called acetylcholine, or ACH. This messenger travels across a tiny gap, the neuromuscular junction, and fits perfectly into ACH receptors on the muscle's surface. When enough receptors are activated, the muscle contracts. In myasthenia gravis, the immune system produces abnormal antibodies. These antibodies block, alter, or destroy the ACH receptors on the muscles. The result? The muscle doesn't receive the contract message properly. With fewer available receptors, the muscle becomes weak and easily fatigued. Key symptoms of myasthenia gravis. The hallmark symptom is fluctuating muscle weakness. It can affect any voluntary muscle, but certain groups are more commonly affected, especially early on. 1. Eye muscles, or ocular myasthenia. This is the most common initial symptom, over 50% of cases. Ptosis, drooping of one or both eyelids. Diplopia, double vision, which can be horizontal or vertical and often improves by closing one eye. 2. Face and throat muscles, or bulbar weakness. This can be more serious as it affects essential functions. Dysarthria, slurred, soft, or nasal-sounding speech. Dysphagia, difficulty swallowing, chewing, or choking on food or liquids. Facial expressions, a snarling look when trying to smile, or a loss of facial expression. 3. Limb and neck muscles, or generalized myasthenia. Weakness in the arms, hands, fingers, and legs. This might manifest as difficulty lifting objects, combing hair, climbing stairs, or rising from a chair. Neck weakness can cause a dropped head sensation. 4. Respiratory muscles. In severe cases, the muscles that control breathing, like the diaphragm, can become weak. This can lead to shortness of breath, especially when lying down or after exertion. This is the most dangerous aspect of MG. Causes and triggers. Autoimmunity. The root cause is the body's immune system malfunctioning. Why this happens is not fully understood. The thymus gland. This small gland in the upper chest, behind the breastbone, is part of the immune system. In many people with MG, the thymus gland is abnormal. Thymic hyperplasia. The gland is abnormally large. Thymoma, a tumor of the thymus gland, usually benign. The thymus is thought to be the site where the faulty immune response is triggered or maintained. Symptom triggers. Certain factors don't cause MG, but can make symptoms worse. Illness or infection, stress and fatigue, surgery, extreme heat, certain medications, example, some antibiotics, beta blockers, Botox. How is myasthenia gravis diagnosed? Diagnosis involves a combination of methods. A blood test. The most definitive test looks for the abnormal antibodies in the blood. Example, AChR antibodies, MuSK antibodies. Neurological exam. A doctor will test reflexes, muscle strength, eye movements, and look for fatigue with repeated movements.
repetitive nerve stimulation, a type of nerve conduction study that sends small electrical pulses to nerves to see if the muscle's response weakens with repetition. Single-fiber electromyography, or EMG, a very sensitive test that directly measures the electrical activity in individual muscle fibers. Imaging, CT or MRI, is used to check the thymus gland for a thymoma or enlargement. Treatment options. There is no cure for MG, but treatments are very effective at managing symptoms and allowing most people to lead full, productive lives. Treatment is highly individualized. Medications. Cholinesterase inhibitors, example mestinon or pyridostigmine. These are often the first line of treatment. They don't fix the underlying problem, but improve symptoms by preventing the breakdown of acetylcholine in the neuromuscular junction, allowing more of it to reach the few working receptors. Immunosuppressants, example corticosteroids or azathioprine. These drugs suppress the overactive immune system to reduce the production of the harmful antibodies. Intravenous therapies. These are for severe symptoms or flare-ups. Plasmapheresis, or plasma exchange, a procedure that cleans the blood by removing the plasma containing the harmful antibodies and replacing it with a substitute. Intravenous immunoglobulin, or IVIG, a treatment that provides a high dose of normal antibodies from donated blood, which temporarily overrides the effect of the abnormal antibodies. Surgery. Thymectomy, the surgical removal of the thymus gland. This can improve symptoms and may even lead to remission, especially in patients with a thymoma. Biologic drugs. Newer, highly targeted therapies, like rituximab or eculizumab, are available for difficult-to-treat cases that don't respond to standard treatments. Myasthenic crisis, a medical emergency. A myasthenic crisis is a life-threatening complication where the respiratory muscles become so weak that the person cannot breathe on their own. Signs include severe difficulty breathing, shallow breathing, and inability to swallow. This is a medical emergency requiring immediate hospitalization. Treatment involves respiratory support, often with a ventilator, and therapies like IVIG or plasmapheresis to quickly reduce the antibody attack. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you have or suspect you have a medical condition, please consult a qualified healthcare provider.